Welcome to your second trimester. I'm Bridget Tyler, birth doula and childbirth educator. I'm also a mama currently pregnant with my third, and I'm just so happy you're here. And if you're new, be sure to subscribe and hit the bell so you don't miss out on any future empowering pregnancy, birth, or motherhood videos that come your way. So you are 1/3 of the way through your pregnancy and meeting your little one that's growing in your womb. That is so exciting. Now, for some of you, it might feel like it's sped on by, and for others of you, it feels like each week is just dragging on. I feel like for mamas who had a hard first trimester with morning sickness and maybe are still dealing with it, it can feel like it's taking a while, but each day you are getting closer to meeting your little one, and they're using each and every day to grow into the little human they'll be at birth. If you are still struggling with morning sickness, especially if it's severe, your care provider, if they haven't already, might suggest medications like Zofran, which is a prescribed medication, or a Dramamine-containing medication that you can get over the counter. Sometimes the smallest dose is enough for mamas to feel like they can just function if they're dealing with severe morning sickness, often referred to as hyperemesis gravidarum. Now, at 13 weeks, your baby is the size of a lemon, and your uterus is growing out of your pelvis, which means your belly is likely starting to noticeably grow if it hasn't started already. It's common for first-time mamas to take a bit more time to show than it does for women who've given birth before. Your baby's body is continuing to grow, so their head, which was really big compared to their body before, is now starting to look a little bit more proportionate, but still is about 1/3 of baby's overall size, so still rather large. All of baby's organs are formed, but are continuing to mature. Your baby's bones and teeth are becoming stronger and denser. They're moving their body around a lot more, and as they are sucking in and swallowing the amniotic fluid that they're surrounded by, they're peeing it out, which we've already talked about in previous weeks. But meconium is also being formed in their intestines, which is sort of like baby's first poop that they usually pass after they're born. Now, this poop is different than our poop because it's actually sterile. It doesn't contain any bacteria, so there's nothing to be grossed out about it. Now, as your baby grows and your uterus grows too, your blood volume is increasing, etc., there's going to be more weight in your belly. Obviously, you might start to notice this increase in pressure when you're lying on your back or in your pelvic floor when standing. Many mamas are scared about sleeping or lying on their back because of the potential of reduced blood flow between mama and baby. But I want to replace that fear with some encouragement in your very wise, intuitive body. Your body will tell you if it needs a different position to be in before it can significantly impact you or your baby. As your baby grows heavier, more weight is placed on the vena cava, which is a blood vessel that takes blood to your uterus. And if you start to feel dizzy or lightheaded when you're lying on your back, that's a good indication that you should simply turn on your side to relieve some of the pressure. But if the position is comfortable for you, there likely isn't a reason for concern. Your body is wise. It wants to keep you and your baby safe. When it comes to pressure on your pelvic floor, now is a really good time to start practicing pelvic floor balancing exercises. This is something that we do throughout my 6-week prenatal fitness program that helps prepare your body for birth and protects your body from pelvic floor issues and core dysfunction during and after pregnancy. And that's linked down below, but you can also check out my fitness channel that is linked up in the corner of this video as well. During pregnancy, having that regular exercise regimen that's tailored to your pregnancy is really beneficial for relieving discomforts and then preparing your body for birth, which you're getting closer to every day and week. So now's a great time to start that if you haven't already, especially since the second trimester usually brings on some renewed energy after the fog and fatigue and sickness of the first trimester. Well, mama, that wraps us up for week 13. I hope you have a beautiful week with your growing baby, and I'll see you next time in our week 14 update.